When we first heard about corona, I think within a matter of weeks, we had this test called RT-PCR. And unfortunately, not anybody could get tested. You had to fit a certain criteria. For example, you had to have fever for a certain number of days, traveled or had contact with somebody with corona if you had to fit that criteria. But thankfully, now 5 months down the lane, we have 3 tests. And so RT-PCR is still one of them. Another one is an antigen testing, which is also called the rapid test because you get the results more quickly. And both of these, if you want to use them, you have to go through the government, as in you have to come in their list of number of people being tested. And then finally you have the antibody test, which advantageously is available to anybody. You may have come across it. Many laboratories are offering it at a cheap cost, and it will tell you if you've been infected in the recent past. So if you take the antibody test, it will show you if you've been recently infected. In that, it will show you if your bodies have developed antibodies to the coronavirus. So knowing that will lift off a huge burden from your heart. So you've got the infection, but you're still alive and you're faring well. And not knowing it tells you that you still have to be cautious, follow the simple steps of wearing a mask, keeping the distance, and washing your hands frequently. Yeah, so we as a community medicine department of Baptist Hospital have around 100 staff, and our activities are varied, beginning from preventive care to curative care, and then we also used to do some special things for elderly, the alcohol de-addiction program, and all of these things. So when corona hit, because of the fear that came along with it and how everybody viewed it, public stopped coming to our clinics, and in general they were fearful to do anything related to medical activities. But as time went by, what we see now is that there is slowly a feeling of having a hold over the whole issue of corona. We know more about it now. So as with anything, as familiarity improves, the fear decreases. And so we do have patients coming seeking medical care, and also things related to corona, counseling, etc. There is a clear difference in the way we medical personnel perceive it, not just the public. And so if I can say, for example, initially we had staff who were hesitant to come to work. Some of them resigned, and so there was a fear that was there with the public, the same way it was with the medical personnel. But the more we read about it, the more research was done, the more the world around came up with facts about corona, and just the fundamental things of the famous acronym is SMS, that is your social distancing, wearing your mask, and then sanitizing often. Just following these fundamental things, we realized we don't easily get infected by this virus. And good proof of that is we've all been working with patients for the last 5 months. Many of us have come across corona, even without knowing it, come across corona patients, but none of us got infected, and at the least a minority got infected. And that is because we kept the necessary precautions, and if we do that, it doesn't so easily infect you as it is made to look like. We have a little over 2,000 staff, and the good news is we've lost none. And that's again proof that if you take good care, take the minimum precautions, with the grace of God, you do not succumb to this disease.